Now we are going to start the assessment part of the arms. With the arms, you want to inspect both arms from the fingertips to the shoulders, noting any areas of edema, discoloration, rashes, scars, or changes in skin texture. You also want to note any changes in the hair distribution or any venous patterns, particularly in hands and the antecubital area. Again, for the purpose of this video, all assessment is being done over top of clothing. So I would assess both both sides of the hands, arms, all the way up from here to here, particularly not forgetting the backs of the arms. Everything looks to be in comparison. Also, you want to assess the temperature of the hands and lower arms with the sensitive part of the back of your hands. If you notice any changes or inconsistency or particular coolness, you can move to the upper part of the arms. Next, you would palpitate the radial pulse with the pads of your fingers. With the amplitude of a pulse, it can be from 0 to +4. 0 is absent, 1 plus diminished, 2 plus is brisk and considered to be within normal limits, 3 is increased, and 4 is bounding, which sometimes is an indicator of arterial insufficiency. You would want to palpitate both sides and compare. If you do suspect that there is arterial insufficiency, then you can determine the patency of the ulnar artery performing what is called the Allen test. So with this, you ask the person to close their hand. You depress or occlude both the radial and brachial pulse. And to assess the ulnar, you have them open their hands, assessing the color, and then release the ulnar and wait for basically the pinkening of the hand to show back up. You would do this on both sides, and then to assess the radial, you would repeat. Open. This time you would release the radial. Not sure if you guys can see that, but hers pinks right up. She has no insufficiency. Next, we're going to try to palpitate the epitrochlear nodes. So with the patient's arm slightly flexed, you want to palpitate between the bicep and the tricep muscles right above the elbow. If you are able to find them, you want to note any size or tenderness. Again, you want to do both sides to compare. Next, we will inspect the legs, and to do that, we prefer the patient to be lying down. Make sure you guys can see her legs and awesome hospital socks. Okay. Again, as with the arms, you want to inspect the legs from the toes to the groin area. You want to note symmetry, size, shape, color, any type of edema, skin texture, hair pattern changes, any swelling, discoloration, rashes, ulcers, scars, or any abnormal venous patterns. As with the upper body, you want to assess the temperature of the feet and lower legs with, again, the back of your hands, the most sensitive part. If any unusual coolness occurs or inconsistency, you can move further up the legs. We want to palpate the superficial inguinal nodes, which is near the femoral, and it's more of a deep palpitation. You want to note, if found, the size, consistency, and tenderness of any nodes found. Again, you would do both sides. Now you want to do the femoral pulse. Since we are in this general area, we would press down and feel for that. Again, you would palpitate that on both sides to make sure there is sufficiency. Next, we're going to examine the popliteal pulses. We do this by flexing the knee slightly, and you press the fingertips of sorry, my patient's ticklish. Press the fingertips of both hands deeply into the fascia. You would compare it to other side. If it's not able to palpitate like this, then the patient can turn over to the prone position and have their leg elevated either on your arm or shoulder, and you can press your thumbs into it that way. We're not going to demonstrate that in this video, but it can be palpated from the patient on their back or in the prone position. Next, we're going to assess the pedal pulse and also the posterior tibial pulse. The pedal pulse is here. It is a light touch because it can be occluded easily, especially on older patients. Then the posterior tibial, it's on the inside near the ankle. Again, we would do both sides. And we're looking for, is it a +2 within normal limits? While at the feet and ankle, we want to assess for any edema, swelling, and compare the size between the feet. Also, you want to press firmly for at least 5 seconds around the foot and ankle area, trying to detect any pitting edema. Next, I'm going to assess the calves and see if there's any. I'm compressing them against the tibia and looking for any firmness, or if she'll tell me if there's any increased tenderness.
No.
Anything?
Mm-mm.
If tenderness or firmness is there, that may be pointing to a deep vein thrombosis. Lastly, with the legs, we're going to assess for chronic arterial insufficiency by checking the circulation. What we're looking for is any color changes by elevating both the legs about 60 degrees in the air and holding it for 30 to 60 seconds. What this does is it lets the feet drain the venous blood. Mild pallor is normal, but you want to watch for anything unusual. And then we ask the patient to dangle their legs, and we're looking for that blood to return to the feet within about 10 seconds and the ankle 15 seconds. So we're going to do that. You also want to assess the patient to see if there's any musculoskeletal things that may prevent them from holding this position, such as a new hip or knee. For the sake of time, we're going to say that that was 30 to 60 seconds, and then I would have her sit on the side of the bed and watch for the color changes in her feet and ankle and assess for the timing of that. Lastly, I'm going to ask the patient to stand and look for any varicosities in her legs to fill with blood, and then just inspect the system for any signs of thrombophlebitis. Also, just general touching of the veins that show up. If any varicosities show up, touching those and palpitating for any pain or tenderness. If there is anything, you want to just note any tenderness, any redness, discoloration, edema, anything that changes from the lying to the seated to the standing position. At this time, that is the conclusion of the peripheral vascular system and lymphatic system. Thank you.